Hi everyone, good morning. I am Dr. Constantine Albany here at Indiana University, and I want to talk to you a little bit about testicular cancer. So this video is aimed to explain to all of you a lot about testicular cancer and how we diagnose testicular cancer, what's the staging of testicular cancer, and eventually we're going to move on to the treatment of different stages of testicular cancer. I'm going to use this PowerPoint presentation here to go over this. And I want to start from the beginning. So this is a picture of an embryo, and as you can see here in the center of the embryo, about 3 weeks old, there is something called the gonadal ridge. This is where the testicles start to form very early in life. And this yellow sac here is the yellow sac. This is the head of the embryo. This is the tail, which eventually will become the legs. And these blue cells here in the yolk sac is basically what is going to be the germ cell, which going to form the sperms in the future. Here on the right side, you can see that actually these genital ridge are actually on both sides of the body, and that will be eventually the testicles, and on both sides. So I'm showing you this because I want to explain that the testicle actually, when they form very early in life, they form in the belly, and then eventually they will descend from somewhere next to the kidneys all the way down to the scrotum. So by the time the baby is born, the testicles should be down in the scrotum, which is good and normal. However, if the testicle does not descend all the way down to the scrotum, we call it undescended testicle. And when I see a patient with testis cancer, I always ask the mom or the dad if when the baby was born, if they have undescended testicles, because this is actually increase the chances of having testicular cancer in the future. So if the pediatrician always examine the babies to make sure the testicles get down to the testicle, and if they're not, they actually do a small procedure to bring the testicle down to the scrotum. So now we'll move on to the testicular cancer. So testicular cancer is really very rare tumor, only 8,000 cases in the United States, and it's very highly curable. So very few people will die of this disease. However, there's about 500 cases a year of death. So 95% are cured of this disease. Now, the next thing I want to tell you that this is really common, and actually the most common cancer in young men. So after the age of teenager, between 15 until the age of 35, this is really the most common cancer in men of this age group. So we really take the testicular cancer very seriously because we aim for cure, and we want to have people go back to their normal life after curing this cancer. And on the picture here, and I'm going to go into this in more details, you can see this is how the tumor looks like on the testicle. And if it is only in the testicle, we call it stage 1. If this cancer has escaped the testicle to go up to the belly, to the lymph node here in the belly, we call them stage 2. If it goes up all the way up above the diaphragm to the lung or to the liver, we call this stage 3. So there is no stage 4 in testis cancer. Is only stage 1, 2, and 3. Now, how do we know that if I have a testicular cancer or not? So if you feel any lumps or bumps in the testicle, or you have a pain in the testicle, always do a self-exam. If you feel any lumps or bumps, you really need to check with the urologist to make sure it is nothing serious. And the urologist would direct you if there is any need for further testing, such as testicular ultrasound. So always self-exam is very encouraged. Use both hands to grasp the testicle, and between the thumb and the first finger. Roll the testicle gently with the thumb, and then feel for any lumps or bumps. examine both testicles, and really, if you feel any lumps or if you're suspicious, please see a urologist. Now, if the testicular cancer is really not diagnosed early, then it might spread, as I showed you before, to the lymph node in the abdomen, and those are closer to the back than to the abdomen. So actually, people might present with back pain, but people might also suffer from belly pain as well if it is not diagnosed early. So those are the common presentation of testicular cancer. So what if you're worried about testicular cancer, or if you feel lumps or bumps in the testicle? Then the first thing to do is to do testicular ultrasound. And what we're going to do is, this is a picture of testicular ultrasound, and that will tell you if there is any mass or tumor in the testicle. And then the most important thing also to do is what we call the tumor markers. And I want you guys to be very familiar with these terms, tumor markers. There's two tumor markers that we use for testicular cancer, and we use them all the time. One of them called the HCG, and the other one called AFP, or alpha fetoprotein. And these are very specific and sensitive for testicular cancer. And they are similar to other tumor markers, such as for the prostate cancer, we have the PSA. So for testicular cancer, we use the SCG and AFP. And these blood tests help us a lot in the diagnosis, and also in the staging and making the treatment decision. So always we have to do these tumor markers when we're suspecting testicular cancer. So if the testicular cancer got diagnosed based on the ultrasound, then the first thing to do is to see a urologist. So the urologist needs to check on you and perform what we call inguinal or chiectomy. So we remove the tumor not through the scrotum, but through a small incision in the inguinal area. And that's the best way, and actually it should be the only way to remove testicular cancer. And then we always check these tumor markers that I just mentioned, both before removing the tumor and then after removing the tumor. Then the urologist will send the tumor to expert pathologist, who's going to determine what type of testicular cancer is that. Is it a seminoma or non-seminoma? And I will explain in more details about the different kind of testicular cancer in the next slide. And then finally, we have to do a CT scan of the abdomen and pelvis, and that will determine if the cancer has spread beyond the testicle to the abdomen or not. All right, so here are the different types of testicular cancer. So when we mention the word testicular cancer, it does not mean one thing. It really can be multiple things. And I really want you to be also familiar with these different terms because you hear them all the time from doctors, and they might be confusing. So I would like to explain a little bit more about this. So testicular cancer can be divided into a seminoma or non-seminoma germ cell tumor. And you hear the term all the time that seminoma is the better one, which is true. It's tend to be a little bit more sensitive to the chemo and radiation. And but all of these tumors are really curable. We need to make sure what type of testicular cancer to recommend the best type of treatment. So again, the non-seminoma is has like 4 different kinds or types. We have embryonal carcinoma, we have yolk sac tumor, choriocarcinoma, and teratoma. So the teratoma, it's very interesting tumor because it really does not look like cancer. It actually looks like bone, cartilage, hair, or teeth under the microscope, but they're really not supposed to be in the testicle. And the way I try to explain to my patient how they can remember these different types of testicular cancer, if you think about it, testicle has sperms, and sperms is when they fertilize the egg, they form embryos. So the word embryonal carcinoma, it's from the embryo, really. And when we check the blood test for the testicular cancer, we check this tumor marker, the HCG and the AFP, and the HCG is the same as the pregnancy test. So a lot of young men joke sometimes, and they do a pregnancy test and they turn to be positive in young men, and this is actually a sign that they might have testicular cancer. So the other tumor is the yolk sac tumor, and this looks like the sac around the embryo. And that was the yellow sac that I showed you guys in the first image on the embryo that presented. And the yolk sac tumor secrete this tumor marker called the alpha-fetoprotein. So as you can see, alpha-fetoprotein can be made by both the yolk sac tumor and the embryonal carcinoma. Choriocarcinoma, it looks more than like the placenta of the that feed the embryo. So it has a lot of blood vessels and it might bleed easily, and it does secrete HCG. So HCG tend to be very high with choriocarcinoma. Now, teratoma does not really secrete any tumor markers, and as mentioned before, it looks like bone or cartilage, but it's really not supposed to be in the testicle. And finally, the seminoma can also secrete some HCG, but it's a much lower level compared to the non-seminoma. Now, testicular cancer is not only germ cell tumor. So all of these tumors, different types that I mentioned, those called germ cell tumor. So testicular cancer sometimes, very rarely, can be a different kind of cancer. It could be from the cells supporting the sperms. So we have Leydig cell and we have Sertoli cells, and those also can become tumorous. Those are very rare, and we will not be discussing them over here. I hope in the future I will have a different lecture on these different rare types of testicular cancer. But for tonight, we will focus on the germ cell tumor of the testis. All right, so let's move on to the staging. So as I mentioned before, stage 1 is a tumor confined to the testis. So it's only in the testis. You remove the tumor and there's nothing else. So you do CT scan of the belly. It's clean. There is no tumors there. You do the tumor markers. The tumor markers are normal. So that means it is stage 1. So as you can see, different from any other disease, we use here both the CT scan and also we use this tumor marker to determine if the body is clean of cancer after removing the testicle. So we don't depend only on the CT scan. We really want to see what the tumor marker before the testicle were removed. So assuming they were high, either the SCG or the AFP, removing the testicle, and this tumor marker would check them again a few weeks later if they go back to normal, and the CT scan if is normal, so that means it's a stage 1 disease. Now, if the tumor markers really stay high after removing the testicle, or they keep even going higher, or they don't really go back to normal, we call that stage 1S. The letter S is from the serum tumor marker, if they're still elevated, and that means that there's still some cancer hidden in the body, most likely in the belly, and in that case we will need to use chemotherapy. The second stage, so if this cancer escaped to the belly here, to the lymph node, we call that stage 2. And I will show you more picture about this in more details, but you know, testis cancer spread in a very predictable way. So in a simple way, the left testicle cancer goes to the left side of the belly, and the right testicular cancer go to the right side of the belly. Because if you remember from the first picture I showed you on the testicle, when they formed early in life, they form in the belly and they descend all the way down to the scrotum. So they leave track behind of lymph nodes. And if the left testicular cancer gonna spread, it will really go to the left side of the aorta. So this is the left kidney over here, and this is the right kidney, and this red artery here, this is the aorta. So left testicular cancer usually spread to this space between the left kidney and the aorta. While if the right testicular cancer is going to spread, it will spread between the aorta and the vena cava, and that's the blue vein over here. So we know exactly where testicular cancer is going to spread, and that's why we do the CT scan to look for this lymph node in specific areas. We call them the landing zones. And if those lymph nodes are enlarged, this makes us very suspicious that the cancer has actually spread to the abdomen. And finally, if the cancer escaped the abdomen to go up to the lung or to the liver or even to the brain, So this is stage 3. And again, we don't have stage 4 in testicular cancer. So to re-summarize that picture, so always you need to see an expert oncologist when diagnosed with testicular cancer. The testicular cancer is really rare tumor, and you need to seek the help and the expert of oncologists who treat testicular cancer all the time. And what we will do is to do the tumor markers, as I mentioned above. And if they are back to normal after orchiectomy and the CT scan is normal, so this is stage 1 testis cancer. If the tumor markers are still high, or they did not go back down to normal even after a few weeks of removing the testicle, but the CT scan is normal, so we call that stage 1S, as I mentioned before. And I will talk about the treatment option in the next lecture, which is going to be part 2. And if the CT scan showed disease in the abdomen in the specific areas that I mentioned, we call it stage 2. And finally, if this CT scan showed that the cancer is spread to the lung or the liver, we call it stage 3. And here I'm going to show you some picture what we're looking at on the CT scan. So, this is a CT scan. And as you can see, these are the lungs on top here, and this is the heart in the middle. This is the liver. And this is CT scan with contrast. This kind of white or light gray color, this is the aorta, and it's split here in the bottom to spread the blood down to the legs. And here on the left side of the aorta, there is this lymph node which is enlarged, and you can see it's actually larger than the aorta. So this is a very suspicious lymph node in what we call the landing zone of left testicular cancer. So if we see something like this on the CT scan, that tells us that actually there is a stage 2 testicular cancer that has spread from the left testicle to the lymph node here on the left side of the aorta. So this is how stage 2 left testis cancer looks like. On the other hand, again, this is a very similar picture, and this is the aorta. And you can see how the aorta is different here from the image on the right because there's no contrast on the CT scan here. So contrast really give you a better quality pictures. And then on this side here, this is the vena cava. So this is the vein that basically brings the blood back from the lower part of the body to the heart. And in between the aorta and the vena cava, there is a tumor here. So this is a tumor that's basically between the aorta and the vena cava, and that's very suspicious for right-sided testicular cancer. So I just wanted to share with you some of the images to tell you what we're looking at when we do the CT scan. And also I wanted to show you what the cancer looks like on the lung. So this is a testicular cancer that has spread to the lung. You can see a big nodule over here and smaller nodules over here as well as here. So this is cancer spread to the lung, and this is basically stage 3. And then finally, the testis cancer can also spread to the brain, and this is an image of how the testicular cancer look when it's spread to the brain. All right, so far we have learned in part 1 the diagnosis of testis cancer. We have learned the different types of testicular cancer and the staging of testicular cancer. In part 2, we will go ahead and cover the treatment option for stage 1 testis cancer. And then in part 3, we will go over the treatment option for metastatic testicular cancer. I hope you guys learned something helpful today. If you have any question, please leave me comments. I'm gonna post this video on YouTube, and just leave me a comment. I'm gonna try my best to answer you as fast as I can. All right, bye-bye.